So, with your background in both medicine and nutrition, how do you approach discussions with your colleagues who may be skeptical of diet-focused interventions?
I think they're right to be skeptical because there's been a lot of nonsense out there. Um, and part of the reason that I think medical professionals are right to be skeptical about nutrition is that back when they were in medical school, the diets that were used were things like eat less red meat, eat more white meat, take the skin off your chicken. Um, and doctors would tell a patient to do that. And what happened? Nothing. The patient's cholesterol dropped maybe a couple of points, but not really substantially. And so they thought, well, why are we fooling around with this? Let me give you a statin and I can get your cholesterol down. So I think people are right to be skeptical about that. The problem is that in the past 30 years, nutritional science has raced ahead. And I want to give a lot of credit to Dr. Dean Ornish, who showed, wait a minute, let's go further, both in the diets that we use, where you're really eliminating the animal products for all intents and purposes. And you're putting it in the context of a healthy lifestyle where, you're not smoking, you're exercising, you're dealing with stress. And suddenly you see nutrition supercharged. And people like John McDougall, people, like Caldwell Esselstyn and Michael Greger and so many others have really done brilliant work showing that nutrition can be a powerful force that rivals anything else that we have in medicine. And unfortunately, it's true that when a new medication gets out on the market, there is so many there's so much CME and so much promotion that doctors know about it overnight and get all jazzed up and become cheerleaders for these things. Sometimes rightly so, but all too often they're going a little too far. But when it comes to new diets, I think doctors have been slow, partly because there's less promotion of them, but also, let's face it, doctors don't want to seem like softies. I mean, in some cases, doctors went to medical school with sort of a Ben Casey image in their mind. And to have your image of being a person who races in and saves a life with a difficult surgical procedure with sweat dripping off your brow, and to say, no, all you need to do was to cook a bowl of chili. I mean, that ruins your mental image of yourself. So, doctors have been very slow. Their minds just haven't worked this way. Now, that said, there are so many doctors now who are really promoting nutrition in a terrific way. I was just in Houston, Texas, where Baxter Montgomery is doing brilliant work. Look at the great work that Kim Williams and many others have been doing all along to promote a healthy approach. And I think all doctors are starting to realize that our patients' illnesses, more often than not, are either caused by or aggravated by unhealthy diets, and that these things can change.
And what are some common misconceptions that you encounter with regard to a whole food plant-based diet?
One is that it's expensive. Um, And that comes, I'm going to blame Whole Foods for this, perhaps, because you go there and, there are things that are a little on the pricey side. Okay. However, I want to redeem my good friends at Whole Foods and at every other market, because we did a study. We brought in 244 people. We randomly assigned half to do a low-fat vegan diet and the other half to not change their diets. And what did we do? We took we tracked their food purchases. I mean, how much did you spend? Whether it's at Whole Foods or Safeway or at an Italian restaurant or at a fast food place. And what we found was that the people starting the vegan diet they did spend more on vegetables and on fruits and on beans and grains, but they spent less, or shall I say nothing, on cheese and meat and stuff. And when you netted it all out, the vegan diet costs 16% less. Your food purchases are 16% less compared to what they were before, which is about $500 a year per person. Okay, let's say you got a family of four. Do the math. You are going to get a bang-up killer vacation every single year with the money that you're saving from your healthy diet. Plus, you're probably going to need less medication too. And I want to salute my friend Tom Campbell, Colin Campbell's son, who did a great study and showed exactly the same thing. He put people on the DASH diet. He tried 3 different diets. And the one that's cheapest of all is a whole food plant-based diet. So that's number one. Number two, and this might even be a worse one, is that doctors say, okay, the diet will work, but it's unsustainable. Or who would want to do that? It's too strict, impossible. We've studied this at least 5 or 6 times in an organized way. And the first time was with Dr. Ornish's patients. Back in 1990, when he published his work in Lancet on reversing heart disease, which made, everybody thought this is incredible. This will work, but it's too strict. I had the honor of participating with Dr. Ornish and Larry Sherwitz, the psychologist who worked on his team, to interview every single member of his experimental group that went on a plant-based diet and the control group that was eating chicken and fish. And what we found was that the people consuming the plant-based diet did grumble a little bit. I mean, they said it took, there was a process of transition. It took them 4 or 6 weeks to get totally used to it. But they were used to it. They liked it. And especially they were rewarded very quickly with weight loss and better energy, and their angina was gone within a month. The comparison group that was eating chicken and fish, they complained about their diet. They said it's just chicken and fish and chicken and fish and chicken and fish, and I'm not losing any weight, and I'm not getting, I still got chest pain. What's the point of this? So we repeated this part of the study, the acceptability. And we found, I don't care if you have diabetes, I don't care if you have overweight, I don't care if you're a young, healthy person or just changing the diet. It's like jumping in the deep end of the pool. It takes a minute to accommodate to the water, but pretty soon you can think, this is why people like swimming. This is great. I love this. So why do a diet that doesn't give you results? Do a Mediterranean diet. You're not going to lose weight on a Mediterranean diet. Do a diet that is going to solve your problem. Let's put it in history.
And what are common challenges that people have moving to a whole food plant-based diet, and how do you suggest people overcome those challenges?
Oh, great thing. First of all, it's good to work find some supportive, some kind of support structure for you. That can be an online class. We have what we call Food for Life at the Physicians Committee for Responsible Medicine. Go to our website, pcrm.org, Physicians Committee for Responsible Medicine, pcrm.org. Search for Food for Life. I've got 400 instructors, maybe more than that now. And they're all across the United States and in many other countries. And they've got classes. And the beauty of it is you're trying to follow a healthy diet. They're going to give you motivation, but they're also there to answer your questions. So we've worked with thousands of people in research studies and in the Barnard Medical Center here. It's, by the way, the medical center, barnardmedical.org, and we do telehealth all over the place and can support you. But people find they want to change the diet. The diet change is easy. Going vegan is surprisingly easy. Limiting oil is hard. I mean, it's not hard for whole foods like fruits and vegetables and grains and beans. I mean, they don't have much oil in them, but it's hard with packaged foods and with restaurateurs. They're in love with their bottle of olive oil. But you'll discover that there are ways around all that. And that's why I say get a little bit of support, because you'll have a chance to answer your questions. Okay, how do I replace eggs in a cake recipe? Or let's say I'm invited to a family get together or a wedding, what do I eat? Or if I'm going to a restaurant, what could I eat there? So they'll answer your questions and make it easier for you.
So, even within, this conference where we have, we try to seek people out who are experts on various things, and we'll get people who have conflicting information to share. And then you go to social media and it's even wider. You've got, the keto diet and whatever the new diet is of the day. How do you suggest people navigate all of the confusing and often conflicting information that they are bombarded with regard to health and diet? And what sources, obviously your website would be a good place to start, but what sources do you suggest to get reliable information?
Okay. First of all, I feel your pain, because it's very, very hard to separate out all the earnestly propelled nonsensical diets from diets that are actually evidence-based and real. And even diets that are unhealthy sometimes have some evidence for them. That's where, the pork producers are funding research studies and they try to make their products look good. I guess one overall theme that should be said is anyone who wants to sell you a paleo diet or a low carbohydrate diet, we are not cats and dogs. We are not in the biological family of carnivores. Meat is not our thing. Human beings are cousins of chimpanzees and gorillas and bonobos and orangs. And they are not eating ice cream. They don't eat dairy at all, okay, right? Meat is not their big thing. They are either entirely or largely vegetarian, vegans in their food choices. Um, so anyone who wants to suggest that we are hunter-gatherers who have been hunting, we didn't hunt, successfully until the Stone Age, when our bodies were already formed. And the Stone Age is when we had arrowheads and knives and things like that. But we are and always have been uh, essentially plant-based eaters in our nature. The problem that we have is that we get seduced by stuff. So we get seduced by burgers and steak and soda and every other kind of thing.
And how do you suggest that we communicate to people who are curious, but obviously they've heard a bunch of conflicting information, in order to, I guess, enlighten them or share this kind of information? How do you suggest it? I mean, you're obviously an expert on this stuff. How do you suggest, or how do you communicate with people when you're talking to somebody who's new and just beginning to learn about this type of stuff?
I think, well, first of all, I think people are right to be skeptical. And so I may say things based on the research that we've done. And we've done so many research studies, and published in top medical journals. But even that does not set aside people's natural reticence about accepting a new idea or giving up things that they might be addicted to. So I think a couple things have to be said. One is we use multiple modalities to get information out. And first and foremost, here at the Physicians Committee for Responsible Medicine, we work with physicians because they have to carry the message forward. So every August here in Washington, D.C., we have the International Conference on Nutrition in Medicine. And doctors love it. This year it's August 15th. In fact, the editor of The Lancet is going to give the welcome remarks, and Representative Adam Schiff is welcoming people too. So it's a bang up great event with superfood and everything. But we also have continuing medical education for doctors and apps. And then when I write a book, it's because we do research studies that are too technical for your average person. So the Power Foods diet is my way of saying, this is what we found. Let me give you a pathway to do what we found. But I think also, in addition to the fact that I put the references in and I try to make sure it's really clear and compelling, but I also encourage people to focus short term. Try it. And if you aren't, let's say you want to lose weight and you're trying my approach. If you're not losing weight, it's not working. I don't want you to be satisfied with, well, I feel better or I'm losing inches. That's nonsense. If you're using this approach, the scale has to change. And so I want you to see that. If it's not happening, then we're not doing it the right way. So the point is, try the diet, focus on the short term, and make it work now. My goal is to not have you have this problem a year from now, whatever issue it may be. Let's do what we can to solve it. So I know there are a lot of doctors who say, well, I got to meet people where they are. Baby steps. That is not my approach. If you come in with pneumonia, I'm not going to meet you where you are. Where you are is in the emergency room. I'm going to help you to get cured now. If you've got a weight problem that is demoralizing you and preventing you from enjoying life, I want to fix that problem with you to the extent we can, and I want to do it now. And that's true with diabetes and so forth. So I'm going to hold your hand. We're going to jump in the deep end of the pool together, and we are going to enjoy the bodies that we're in.
Great answer. So, we just had Dr. John Abramson on today. I don't know if you're familiar with his work. He has a book called Sickening.
He's a terrific researcher, and he has done Harvard proud.
So, given what he talks about with regard to the capture of the medical journals, the fact that they may not be the reliable sources that many doctors think they are, how do you stay abreast of what's going on in the medical world, and how do you interpret the research that you see in these journals in light of the fact that they may not be as clear, of intent as they appear to be?
We have to publish our findings in journals, and we always go for the very best journals. We want to make sure that our work is carefully reviewed and published in good journals. But we are seeing problems with the journals, not just the ones that Dr. Abramson has highlighted with industry funding, but it gets worse. There is now so much online funding. There is one journal in particular that has gotten my attention. It's called Nutrients. It's published by a big publisher called MDPI out of Switzerland. And Nutrients is published online, so they're not paying anything for ink. They're not paying anything for paper. And they publish hundreds of articles every single month. And I published in this journal, and I've been a reviewer for it. And I get 5 or 6 invitations every year to publish again. But what got my attention was that they were publishing all kinds of things that I don't believe they should have published. I'll give you an example. They published an article on saffron, the spice. And the idea is could saffron be an antidepressant? Well, you would think, okay, I could bring in volunteers and feed them saffron and see if their mood's lifted with a paper and pencil test. That's not what they did. They fed this compound to mice, and mice don't eat saffron, so they have to gavage them. And then mice also can't tell you if they're depressed. So they drop the mice in cylinders of water, and they set a stopwatch, and they timed how long they would struggle, using that as an index to their joie de vivre. And then they reported that saffron is an antidepressant. So I wrote to the journal. I said, wait a minute. It looks to me like you're publishing unethical stuff. And the reason that you are doing it, in my opinion, could be because you charge a $3,000 author fee for everybody to publish in your journal. And that's true of everybody who's publishing in this journal. And they have come back to say, well, a committee approved that experiment. I mean, you can call it what you want. We've had a big, long wrangle with them, and we've seen one experiment after another that frankly makes your hair curl. So I now no longer publish in Nutrients. We've just considered them to be not of the standard that we want to see. Now, I'm hopeful that they'll improve, but there are hundreds and hundreds of these. I kid you not, every day, every single day of my life, I get a request from about 20 or 30 journals to submit an article to them. These are online journals that want my author fee, which I'm not going to do. But they are all publishing, they are press releasing their results. And sometimes it's something like saffron's an antidepressant. Well, you look at the fine print, it was an animal study. That was not worth the paper, in my view, the paper it was printed on, except it wasn't even printed on paper. So there is a lot of what I believe to be junk out there.
What kind of advice do you have for medical professionals looking to incorporate nutrition into their practice more effectively?
Okay, imagine that you're an orthopedic surgeon. You just did knee surgery on somebody. The patient now needs physical therapy. You refer them to a physical therapist, right? Or you've got one on staff, right? You would never not do that. If you said to the patient, well, I don't even know a therapist, I can't help you, they would say you're incompetent. Okay, the patient comes in and says, I need to lose weight because if I could lose weight, maybe I wouldn't need blood pressure drugs. And the doctor says, well, I don't have a dietitian for you. I don't even know who to refer you to. What? Wait a minute, I've got a diet-related problem. Why can't you help me? If you are a doctor and you do not have a food professional to refer to, you don't have a good practice. So how can you solve this problem? We've set up a new service called the Preferred Dietetic Referral, PDR, Preferred Dietetic Referral. And so you go, it's or Preferred Dietitian Referral.org. You search there and you will find in your state a dietitian you can refer to, and they through telemedicine can see that patient. So if you're the doctor, first, you do not have to provide an hour of teaching for every patient. In our clinic, our doctors need about 3 minutes to describe the diet the patient needs to be on. Then you refer them to a dietitian, and it has to be a dietitian who knows, understands, believes in, and personally practices a low-fat vegan diet. If they don't, they're not going to teach properly. And the PDR program that we have has them. It's free referral. So you go to preferreddietitianreferral.org, you find a dietitian, and you say, talk to that dietitian. I want you to see that dietitian 3 or 4 times, or every week, 6 times, whatever. They may or may not take insurance, but who cares? $75 a throw. You're not going to go broke with that. So you're seeing the doctor, you're getting a good diet, then you're getting good support from the dietitian. See one of our Food for Life instructors. They are all great. They've got great online classes. Many are free, some are a small fee. And what you're getting is support to stick with it. So if you're a doctor starting out, stay a doctor. Your job is to understand the mechanisms and to do the monitoring of the patient. You do not have to be the nutrition coach, but find Food for Life instructors you can refer to, find dietitians you can refer to. They will take the burden off your shoulders, and you can be the doctor you want to be.